In this video, we're going to discuss and demonstrate counterstrain for the cervical spine, specifically for the anterior tender points. As I'm going through this demonstration, I'm going to be touching a few different areas along the side of your face, by your jaw, and by your ear, down your neck, and also in the front of the top of your chest by your collarbone. If you're uncomfortable or if anything is tender, please let me know. If you need me to stop or change what I'm doing, let me know and I can stop at any time. Is it okay if I begin?
Yes.
All right. So we're going to start by identifying our tender points. We're going to begin with AC1. And for AC1, we have two different tender point locations. We have our transverse process tender point and our mandible tender point. So we're going to start by finding our AC1 transverse process. And we can find the C1 transverse process either immediately inferior or a little inferior and anterior to the mastoid process, somewhere between that mastoid and the mandible. And right here, I'm feeling her transverse process. If you're unsure where that transverse process is, once you think you feel something on both sides, you can take your fingers and try to translate that C1 left and right, and you'll feel it poking out on the other side. You can also take your fingers and try to pinch both sides of those transverse processes, and you'll feel C1 become pinched between your fingers. And I feel C1 transverse processes pretty clearly right here. And is there any tenderness on either side?
No.
Okay. Now, our other option for AC1 is going to be AC1 mandible tender point. And we're going to shift off of the transverse processes over to the posterior aspect of the mandible, and we're going to press anteriorly to find our tender point. And is there any tenderness on either side?
Yes, on the right.
On the right. And now we're going to move down to AC2. So going back down to our transverse processes of C1, we can move inferiorly and try to find the transverse processes of C2. If it's unclear exactly where they are, we could come back to the midline, then move to the paraspinal musculature, articular pillars, and then move lateral again and find our transverse processes. And what we want to try to find is the anterior lateral aspect of those transverse processes, and we're going to find the tender points along that anterior aspect on either the anterior or posterior tubercles of those transverse processes. And here we find C2, and is there any tenderness there?
No.
And then we're going to move down one to C3. Any tenderness there?
Yes, on the right.
On the right. And then we're going to move down to C4, again pushing posteriorly and medial. Anything there?
No.
And then moving to 5. Anything there?
No.
And then moving down to 6. And right here. Any tenderness on either side?
Yes, on the right.
On the right side. And then for AC7 and 8, these are going to be a little bit different, and they're going to correlate to the clavicular and sternal attachments of the sternocleidomastoid muscle. So thinking about our origin insertion of the sternocleidomastoid muscle, we have our mastoid superiorly, and then we have our clavicular attachment and then our sternal attachment. And if we want to better visualize those muscular attachments, we can have our patient turn their head slightly to the left and then lift their head up to the ceiling. Go ahead and lift their head slightly. And then we can see those attachments a little bit more clearly. We can see the sternal attachment more medially, and then we can see the clavicular attachment a little bit more laterally. So go ahead and rest your head. So we can push at the clavicular attachment for AC7, so that's on the superior aspect of the clavicle. And is there any tenderness on this side?
Yes, on the right.
Okay. And then we can also test AC8 at the sternal attachment, so on the medial aspect of that clavicle where the SCM attaches into the sternum. And is there any tenderness on this side?
No.
No. So now that we've found all of our tender points, we're going to review the expected treatment positions for each of them. So now for AC1, since we had a significant tender point on the mandible, we're going to go to AC1 mandible, and we're going to try to find that tender point. So we're going to use our index finger in this case, find our tender point. Is this where it was?
Yes.
Okay. So we're going to establish our pain scale as a 10 when we're first pushing on that tender point. And again, with counterstrain, after you've initially established that pain scale, you don't need to be pressing or mashing on that point after you've established that. You can lighten your contact, but still maintain your contact throughout the entire treatment until you reassess at the end. So we've established our tender point. We're going to call this a 10 out of 10. I'm going to position you, and then we're going to compare to that 10, okay?
Okay.
So I'm making contact with that tender point. And now for AC1, either transverse process or mandible, we're going to have the same expected treatment position, which is going to be marked rotation away from the tender point. So in this case, rotation to the left, and then we can compare it to that original 10. What's the tenderness now compared to the 10?
A 2.
A 2. So now if we haven't yet reached a 0, we can fine tune our positioning with a little bit of flexion, so head flexion, and then a little bit of side bending away, as well as a little more rotation away. And what's the tenderness now compared to the original 10?
0.
0. So now that we've achieved the 0, we're going to maintain this treatment position for a full 90 seconds. We're going to want to make sure that our body posture is in a reasonable position so that we can sustain this contact without causing any discomfort for ourselves. And we're going to say that we've held it for 90 seconds, and then we're going to slowly return our patient back to a neutral position, slowly and passively, while maintaining contact with that tender point. And then once we return our patient back to a neutral position, we're going to again press on that tender point to assess for tenderness. And what is the tenderness now compared to the original 10?
0.
Great. So now we're going to move down to our next tender point, which was on AC3. So moving down from the mastoids to the transverse processes of C2 and then C3, we're going to push on the anterolateral aspect of the transverse processes and try to find our tender point. So was this where it is?
Yes.
Okay. So again, we're going to establish our pain scale. We're going to call this a 10 out of 10. I'm going to move you around and we're going to compare it to that 10, okay?
Okay.
So now here, I can take my left hand and I can either contact the transverse processes or the articular pillars, and I'm actually doing both with my left hand, with my index finger on the transverse processes and my middle finger on the articular pillars, so that I can sufficiently side bend and rotate to maintain control of that segment as I'm moving it in space. So now my expected treatment position for C2 all the way to C6 is going to be essentially the same with just varying degrees of flexion, side bending, and rotation. So for C3, I'm going to flex until I feel some tension at that segment, and flexing by lengthening the cervical spine and slight lift of the head off the table. And then I'm going to side bend to the left by translating the vertebra to the right, and I'm going to add some rotation as well until I feel a little bit of tissue texture change. And once I've gotten to that relative position, I'm going to ask my patient to compare to that original 10. So what's the tenderness now compared to that original 10?
2.
A 2. And if I still haven't achieved 0, I'm going to try to fine tune at least 1 or 2 times until I can find a better position. So a little more flexion, a little more side bending away and rotation away. And what is that tenderness now?
0.
Okay. And if I'm unable to achieve a full 0, I can settle for any position that achieves at least a 70% reduction in tenderness. So now that we've held this for about 90 seconds, we're going to slowly and passively return our patient back to a neutral position without losing contact with that tender point. And then once we're back at that neutral position, we're going to go ahead and press on that tender point. And what is the tenderness now compared to the original 10?
0.
Great. So now comparing AC3's expected treatment position to AC6, if we were contacting 4, 5, and AC6 on this right side, to achieve our expected treatment position, we are going to need to flex the cervical spine a little bit more to get down to that segment by lengthening the cervical spine, lifting slightly off the table. And again, with our left hand, we're going to be cradling and stabilizing the cervical spine so that we can maintain good control. And now with our flexion approximated to that segment, we can then side bend away and then rotate away until we feel some kind of tissue texture change. And then we would compare that tenderness to the original 10. We'd fine tune as needed with additional flexion, side bending, and rotation. If needed for additional flexion, you can also stand up to maintain a good position while you're maintaining also your side bending and rotation. And then after you hold it for 90 seconds, you'd slowly and passively return the patient back to a neutral position without losing contact with that tender point, and then you'd reassess that tender point before moving on. So now for AC7, we're going to find our tender point along the superior and posterior aspect of that clavicle where the sternocleidomastoid muscle attaches. And again, if we need help finding it, we can have our patient rotate their head and lift their head off up to the ceiling, and we can see where that muscle attaches right here. And then you can go ahead and relax your head. So once we've found that point, we're going to push on it, and I believe it was tender before. Is it still tender here?
Yes.
Okay. We're going to call that a 10, and now we're going to reposition you and then compare it to that 10, okay?
Okay.
We're going to call this a 10 now. And now for AC7, because we're thinking about now shortening the sternocleidomastoid muscle, we're going to try to bring the mastoid close to the clavicular attachment of that SCM. So how are we going to accomplish that? We're going to accomplish that with marked flexion. We're going to side bend towards because we're off of the midline, and then we're going to rotate away, which is going to bring the mastoid, the right mastoid, closer to that clavicle on that right side, and it's going to shorten that clavicular head of the SCM. Now that we've achieved this relative position, what is the tenderness compared to that original 10?
A 0.
A 0, great. So now we're going to hold for about 90 seconds. And if you're unable to hold sufficiently for 90 seconds, another alternate endpoint for treating tender points would be sufficient tissue texture change and release under your finger, which you might be able to appreciate. And we're going to say that 90 seconds has passed, and we're going to return our patient slowly and passively back to a neutral position. All right, and then we're going to compare to that original 10 without lifting our finger off the point. We're going to press again and compare. And what's the tenderness now compared to that original 10?
0.
Great. So now there's a slight difference between our positioning for AC7 and AC8. So first, our contact on the tender point is going to be at the medial end of the clavicle where the SCM attaches into the sternum. And then in this case, because our attachment is more close to the midline and we have a greater distance to bring that mastoid close to the midline, we're going to flex, and it may or may not be as much as AC7, and then we're going to side bend away from the tender point. So side bend to the left, which now brings the mastoid closer to the midline, and then we're going to rotate away as well, and that again brings the mastoid closer to that midline point. So again, we compare to our original 10. We hold it for 90 seconds once we've achieved a sufficient treatment position, and then after that 90 seconds, we're going to slowly return passively back to a neutral position, and then without leaving our contact on that point, we're going to press again and then compare to our original 10. So now as a quick summary of all of our tender points, we have our AC1 transverse process tender point and AC1 mandible tender point, and our treatment position is going to be marked rotation with a little bit of fine-tuning with flexion and side bending away, but that flexion and side bending away is not always required. For AC2 through AC6, we're going to find those tender points along the anterior lateral aspects of the transverse processes. And then for AC2 through AC6, the expected treatment position is going to be flexion with side bending away, rotation away. And then for AC7, we're going to find that along the clavicular attachment of the SCM. So turning our patient's head to the left and then having our patient lift up, we can see where that attachment is. Then we make contact with that point, and then the expected treatment position for AC7 is flexion, side bending towards, and rotation away. And then for AC8, we're going to be contacting at the sternal attachment of the SCM. And then for this expected treatment position, we would flex, not as far as AC7, and then we would side bend away and rotate away to bring the mastoid closer to the midline.